Why is health regarded as a source of power? There is a source of power in the universe. And it is the one living substance from which all things are made. This living substance permeates, penetrates, and fills the interspaces of the universe. It is in and through all things. Like very refined and diffusible ether. All life comes from this life, and this life is all the life there is. A human being is a form of this living substance, and has within them the source of power. This source of power in a person, when in full constructive activity, causes all the voluntary functions of their life to be perfectly performed. It is this source of power in a person which really works all healing, no matter what system. This source of power is brought into constructive activity by thinking in a certain way. We all know that cures are accomplished by all the different and often opposite methods employed in the various branches of medicine. The allopath, who gives a strong dose of a counter-infection, cures their patient. And the homeopath, who gives a small dose of the infection similar to that of the disease, also cures it. If allopathy ever cured any given disease, it is certain that homeopathy never cured that disease. And if homeopathy ever cured an ailment, allopathy could not possibly cure that same ailment. The two systems are radically opposite in theory and practice, and yet both cure many diseases. And even the remedies used by physicians in any one school are not the same. Take a case of indigestion to half a dozen doctors and compare their prescriptions. It is more than likely that none of the ingredients of any one of them will be the same as the other. Couldn't we conclude then that their patients are healed by a source of power within themselves, and not by something in the different remedies? Not only that, but we find the same ailments cured by the chiropractor with manipulations of the spine, by the faith healer with prayer, by the food scientist with recipes, by the Christian scientist with a formulated creed statement, and by the mental scientist with affirmations. What conclusion can we come to in the face of all these facts? But that there is a source of power which is the same in all people, which really accomplishes all the cures, and that there is something in all the systems that under favorable conditions, arouses this source of power into action. That is, medicines, manipulations, prayers, recipes, and affirmations cure whenever they cause this source of power to become active, and fail whenever they do not cause it to become active. Doesn't all this indicate that the results depend upon the way the patient thinks about the remedy, rather than upon the remedy itself? Think about it. There is an old story that furnishes a good illustration on this. It is said that in the Middle Ages, the bones of a saint, kept in one of the monasteries, were working miracles of healing. On certain days a great crowd of the afflicted gathered to touch the relics, and all who did so were healed. On the eve of one of these occasions, some sacrilegious thief gained access to the case, in which the wonder-working relics were kept, and stole the bones. And in the morning, with the usual crowd of sufferers waiting at the gates, the fathers found themselves without the source of the miracle-working power. They resolved to keep the matter quiet, hoping that by doing so they might find the thief and recover their treasures. And hastening to the cellar of the convent, they dug up the bones of a murderer, who had been buried there for many years. They placed these bones in the case, intending to make some plausible excuse for the failure of the saint to perform his usual miracles on that day. And then they let in the waiting assembly of the sick and infirm, to the intense astonishment of those in on the secret. The bones of the thief proved as effective as those of the saint, and the healing went on as before. One of the fathers is said to have left a history of the occurrence, in which he confessed that, in his judgment, the healing power had been in the people themselves all along, and never in the bones at all. Whether the story is true or not, the conclusion applies to all the cures performed by all the systems. The power that heals is in the patient, and whether it shall become active or not does not depend upon the physical or mental means used, but upon the way the patient thinks about them. There is a universal source of life, as Jesus demonstrated a great spiritual healing power. And there is this same source in every human being which is related to this healing power. This is dormant or active, according to the way a person thinks. We can always quicken it into activity by thinking in a certain way. You getting well does not depend upon the adoption of some system, or the finding of some remedy. People with your identical ailments have been healed by all systems and all remedies. It does not depend upon climate. Some people are well, and others are sick in all climates. It does not depend upon avocation, unless in case of those who work under poisonous conditions. People are well in all trades and professions. Your getting well depends upon you beginning to think and act in a certain way. The way a person thinks about things is determined by what he believes about them. Their thoughts are determined by their faith, and the results depend upon them making a personal application of this faith. If a person has faith in the efficacy of a medicine, and is able to apply that faith to themselves, that medicine will certainly cause them to be cured. But though their faith is great, they will not be cured unless they apply it to themselves. Many sick people have faith for others but none for themselves. So, if they have faith in a diet system, and can personally apply that faith, it will work for them. And if they have faith in prayers and affirmations and personally apply that faith, prayers and affirmations will cure them. Faith, personally applied, cures, and no matter how great the faith, or how persistent the thought, it will not cure without personal belief and application. The science of being well, then, includes the two schools of thought and action. To be well, it is not enough that a person should merely think in a certain way. They must apply this thought to their situation, and they must express and externalize it in their outward life by acting in the same way they think. As a person thinketh in their heart, so are they. The Bible. Like, share, comment. Subscribe to Total Transformation channel.